Concerns have been raised about the rollout of the coronavirus vaccination programme in Bradford. One MP is unhappy that the city wasn't selected as a location for the first wave of jabs this week. Now, a leading doctor says that by deciding to use age as a basis for deciding who to vaccinate first, places like Bradford with a younger population but considerable health complications are being overlooked. Sabir Pervez has more.
Historic scenes from Leeds and Sheffield earlier this week as the first group of people received the life-saving vaccine against the coronavirus. But Bradford wasn't chosen as an initial hub, leading to anger from one of the city's MPs.
When I'm looking at my constituency, I've got higher health inequalities, higher deprivation, higher underlying health conditions, less chance of people living, 9 years less life expectancy, and the government, the criteria excludes my local primary care networks from delivering those vaccines in the first phase. It's unacceptable.
The Department of Health says Leeds and Sheffield were chosen initially because of challenges regarding storing the vaccine, and Bradford Royal Infirmary will become a vaccine hub from next week. The criteria for who gets it first is primarily based on age. Now, one leading doctor has concerns that some of the most vulnerable will miss out.
In this immediate phase, we need to equate the health of our population based on the amount of illness that is there in the community and target that population, because putting a blanket age group may exclude certain people who are much younger than the age of 80, who have the same level of physiological resilience as those who are fit 80-year-olds.
In a statement, the Joint Committee on Vaccination and Immunisation told Look North that the priority is based on age, and that's because that's the greatest risk factor when it comes to COVID-19. The committee says that in the future they'll be doing more tailored work towards ethnic minority communities to promote the vaccination. Today, in those communities, there was concern about how easy it would be to get a jab.
It's really important for these members of our community to have access to this vaccine, and they can only access it if walking distance or within a distance where a neighbour can give you a lift potentially.
If there is a service and is required by a woman of say 50 plus, and she's not very confident, she's got language barrier, she has difficulty in using public transport, he finds it difficult to go to out of the area.
Since the start of the pandemic, roughly 1 in 20 people have tested positive in Bradford for COVID-19, and the city remains in the highest tier of restrictions. In the long term, vaccines will help, but the road getting there is not without challenges. Sabir Pervez, BBC Look North, Bradford.